Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Shazwani BTLS. In this video, I will present about scleritis. What is scleritis? Scleritis is an inflammatory condition where it is affected to the white part of the eye, which is called sclera. There are two types of scleritis, which are anterior scleritis, which occurs on the front of the eye, and posterior scleritis, which occurs in the back of the eye. But in this video, we will focusing on anterior scleritis. Anterior scleritis has three types, which are diffuse, nodular, and necrotizing. Firstly, is diffuse. It is the most common type and responds well to the treatment. It causes swelling and redness of the entire front portion of the sclera. Secondly, is nodular. It is the second most common type and causes localized area of inflammation or nodules in front surface of the sclera. Thirdly is necrotizing. It is the most severe form with the greatest damage to the eye. It can have two conditions, which are inflammation or without inflammation. Sclera has four layers from the outside to the inside. Firstly is episclera, the clear thin tissue resting on the top of the whitest of your eyeballs. Secondly is stroma, made up of fibroblasts and collagen fibers blending into the episclera. Thirdly is lamina fusca, a transitional layer between the sclera and the choroid and ciliary body outer layers. And finally is endothelium, the basal or innermost layer of the sclera. So how does it work in our eyes? So basically, scleritis happens when there is an inflammation in the episclera and scleral tissue with injection in both superficial and deep episcleral vessels. It may involve the corneal, adjacent episclera, and the uvea, and that there can be vision threatening. For example, in this slide, nodular anterior scleritis. A scleral nodule, totally immobile, leaves the vessels. The nodule is clearly separated from the overlying congested episcleral tissue. Finally, what are the signs and symptoms of scleritis? Firstly, eye pain and tenderness. Both anterior and posterior scleritis tend to cause eye pain that can feel like a deep, severe ache. It also might feel tenderness in the eye, along with the pain that goes from the eye to the jaw, face, or the head. Secondly is redness and swelling of sclera. The white portion of the eye, which is sclera, can appear red when the vessels on the surface become enlarged. Thirdly is blurred vision. It can lead to vision loss due to the progressive inflammation of the ocular tissues or even morbidity and mortality due to the underlying collagen vascular disease. And finally, photophobia, also known as light sensitivity, like eye strain or dry eyes, or by issue like eye infections, eye injuries, or problems with the structure of the eye. These are the list references that I used in this video. Thank you for watching. Bye. Assalamualaikum.